Hi, my name is Gavin Bell and I'm an enterprise architect working for Agilisys at North Lanarkshire Council. I've been working there for about the last 14 months on a digital transformation projects, and I've been working on other digital transformation projects for the last 5 years. I'm here along with Linda Johnston from North Lanarkshire Council to tell you all about Helping Hands, an application that Agilisys developed the initial version of over one weekend, and which was deployed at 12 local authorities across the UK, and in which NLC played a key role in the creation of a Scottish-specific version that was then adopted by 8 local authorities. Linda, would you like to introduce yourself?
Thank you, Gavin. So as you say, I'm Linda Johnston. I'm the Business Strategy Manager at North Lanarkshire Council, and I've also been in that role for about the last 18 months. I'm responsible for the Council's multi-million-pound digital transformation programme and also for working with our communities as the strategic lead, developing systems and services that fit both with the needs of our customers and our communities.
Thanks, Linda. Moving forward, thanks to all our sponsors for making today possible. And moving on, so we're going to cover off a number of topics today. The background to this is from March last year, Agilisys has been working with UK local authorities and other public bodies to develop a solution based upon Microsoft Dynamics 365 to ensure that support is provided to the most vulnerable. The solution was called Helping Hands and has helped provide support to over 300,000 people, including prescription, medication, food and grocery deliveries, and even dog walking. From that initial prototype, there have been several further versions introduced, and working with the various partners and agencies, we have evolved the functionality and data to ensure the solution can continue to meet the needs and can continue to evolve. During the session today, we will provide more details around the context, background and the timeline, talk about our experience of developing the solution, do a brief demonstration, and then hear from Linda about her experiences from a North Lanarkshire Council perspective. During the initial COVID-19 lockdown, Agilisys worked with the London Borough of Merton to develop the initial version of the Helping Hand solution, built using customer engagement within Dynamics 365 to provide support for our most vulnerable citizens. This initial version was then further developed with the support of several local authorities and partners. Helping Hands provides a way to track contact with those who are shielding, to manage volunteers who assist with activities like medication drops, social contact and deliveries of grocery and shopping. Microsoft were also able to provide support in the form of Dynamics licenses for 6 months. On to the timeline. On the 31st of March, the first 2 cases of COVID-19 were confirmed in the UK. By the end of February, there were a further 23 cases and the first death had occurred. Over 10,000 people had been tested, and there were over 400,000 calls to the non-emergency line 111 in the last week in February. There was also a COBRA meeting on the 2nd of March, and then on the 3rd of March, the UK announced an action plan to deal with the virus, warning that a fifth of the nation's workforce could be absent at the peak of the virus. On the 11th of March, the Bank of England reduced the base rate to 0.25%. On the 12th of March, the UK Chief Medical Officers raised the UK risk from moderate to high, and on the 13th of March, the first death in Scotland from the virus occurred. On the 16th of March, the government announced people with certain health conditions will be asked to isolate, and the first tranche shielding list was provided to local authorities by the local health boards. Linda, I believe this caused some difficulties in respect of data privacy.
Yes, Gavin, so this was the first time that we had really known that we didn't have formal data sharing agreements in place with the health boards, etc., that we were using the data, the KI data as it's called, from to download straight into our systems. And we've had to work really collaboratively over that period to to get the data privacy impact assessments in place. And again, it was the first time that we had managed to push something like that through without the usual bureaucracy. And it shows what can be achieved when you work together and have a common goal.
Yes, I absolutely agree with that. Thanks for that. On the 23rd of March, the full lockdown begins and the Digital Office started a review of the market capabilities. On the 25th of March, Parliament shuts down for a month and the first deaths of NHS doctors are confirmed. Then on the 27th of March, Helping Hands is developed in conjunction with the London Borough of Merton over the weekend. On the 30th of March, Agilisys begins working with the Digital Office to develop a Scottish-specific version of Helping Hands based upon the NLC paper-based questionnaire. Linda, I believe this was rather unprecedented in terms of the local authorities in Scotland working together rapidly to agree a consolidated questionnaire.
So again, Gavin, our Chief Executive, Des Murray, was instrumental in this. We already had an outline questionnaire in North Lanarkshire that we were using, and the Chief Executive had taken that questionnaire to the Society of Local Authority Chief Executives, which is the umbrella organisation for all 32 Chief Executives in Scotland, and got unanimous agreement for that questionnaire to be utilised by all of the organisations at the table, and then we went on to develop it from that background information. But again, unprecedented times, getting all of that information and authority agreement round the table.
Thanks, Linda. I think we'll hear more about that working together across the local authorities in your section. On the 1st of April, Agilisys announced the Helping Hand solution was available to all local authorities across the UK and can be implemented in 24 hours. Microsoft also provides the support for 6 months of Dynamics licenses free. On the 16th of April, the Scottish Government announces a helpline for people shielding so they can make requests for support. 27th of April, the Scottish version of Helping Hands is ready and NLC go live. This version is focused on the front office processes and means that paper-based systems are removed, massively reducing the manual effort and process times. A user group was also established through the Digital Office and work begins on the next version of the questionnaire, which was then used to deliver version 2 of Helping Hands, along with development of enhanced reporting. This updated questionnaire was also reviewed and agreed by the local authorities at a chief executive level through SOLAS, which we just heard about, is the Society of Local Authority Chief Executives. By the 6th of July, version 2 of Helping Hands was ready with an improved user experience and also delivered support for back office processes, allowing data to be provided to external parties. Linda, again, what additional benefits did this provide?
So this was about us providing a seamless service, Gavin. So whilst we were dealing with inbound and outbound calls through the national helpline, it meant that the Helping Hands system allowed us to provide an integrated solution back to our third-party organisations that were actually providing the solutions to the ask of our communities.
Thanks, Linda. During September, discussions started with local authorities who were using Helping Hands to determine if they wanted to continue support beyond the end of the 6 months of free licenses provided by Microsoft. North Lanarkshire decided they wanted to continue with Helping Hands. And on the 15th of October, we migrated the solution from the shared platform into NLC's own dedicated tenant and utilising their own Dynamics licenses. Since then, North Lanarkshire have continued the use of Helping Hands to support the vulnerable, leading into the second lockdown phase that we are in at the moment. Some statistics for you. The Scottish version has been deployed across 8 local authorities in Scotland. Following the easing of restrictions and the ending of isolation, there were a number of options available to local authorities, and 6 of the authorities chose to continue with Helping Hands, including North Lanarkshire Council. Now, in terms of developing the solution, there were a number of challenges occurred and were overcome during the development of the solution. As we have already discussed, the initial challenge was to create a solution to meet a minimum viable product over a single weekend. As you could probably appreciate, this meant a lot of effort. We worked with Merton to define the requirements and agree the minimum viable product, and then delivered that solution all over that weekend. As part of the engagement with Digital Scotland, it became clear that the questionnaire for Scotland was different from England. However, as we have already heard, agreement had been reached across all Scottish local authorities to use the same questionnaire, so that made the process to create a standardised Scottish-wide version much easier. Therefore, a separate version of Helping Hands for Scotland was spawned from that initial version. Changing requirements was another area that presented challenges. From a reporting perspective, as things developed, the data that was required for reporting also developed. The client was able to respond to some of these by creating custom reports on their own, but some also meant further changes to the questionnaire. From a process perspective, the initial process flow was designed for outbound calls using a portal. But when Scottish Government announced that a helpline was to be set up, we realised that the portal would not meet this need. So we had to develop this process within CRM. The solution is based upon Dynamics CRM customer experience with Power App Portal and supports both inbound and outbound calls. The solution is designed so that regular data uploads can be done to refresh and add additional citizens, which then allows the tracking of interactions and resulting support, ensuring that things don't fall between the cracks. The solution also involves extracting data for things like food parcels, and importantly allows information on the delivery of said food parcels to be imported, ensuring that none are missed. Whilst some local authorities have stopped using the solution, the majority are still happy with the solution and are planning to continue, whilst COVID-19 is still prevalent, to enable support not just for those shielding, but also for those that are isolating. We do have some plans to extend the capability of the solution by introducing a customer self-service portal, which would enable people to request support without having to go through a call centre. We've been looking into how we could overlay a GIS mapping solution function to provide better insights. Interestingly, this is something which NLC have done by themselves by extracting the data from Dynamics. We are also reviewing how to get better data insights using Power BI. And finally, we've been working on and have deployed to one local authority the ability to import data on food parcel eligibility from NES, the National Health Service Education Scotland, and also the delivery schedule of said food parcels. We'll now have a brief demonstration from Susan Cloak from North Lanarkshire Council.
Hi everyone, this is an example of a Helping Hands contact form within the Helping Hands system. This is the point at which an operator would start to record the details of an individual who may well be contacting the organisation to ask for help or assistance. What I would say is if that person is already known to us or is a shielding individual, then key elements of this will already be populated. But this isn't the case at the moment because I'm just creating a new contact in the system and therefore I will have to input all of those details. So I'm just going to put in spurious details just now in order that we can show an example of a contact moving forward. So if I put in first and last name, I need to also put in a CAI number of some description. And I also then need to put in the questionnaire status for them. The questionnaire status just allows us to gauge whether or not how many outstanding questionnaires we've got and how those are then assigned to the individuals who manage those individual cases on the system itself. The contact type you will see here, that's in as other. Within this part of the system, I can't change that just now. There is, however, a workflow in the background that will allow me to change that contact type to shielding, if that is the case. But we're assuming here, because it's someone who's phoned in, they may well not be on the shielding list, and therefore the default setting is other for that. I can then fill in the street details. And the town details. And I must fill in a postcode. A postcode is a mandatory part of this, so for that purposes I will use a postcode that I know, which is actually our office building. That's fine. We can put in aliases if someone has an alias or wants to be called a particular name. So for instance, if it's Elizabeth and they want to be known as Lizzie, that can go in there. We can then add in home phone numbers and mobile phone numbers. If someone is either unable or unwilling to provide those phone numbers, we can click across and that information will not be put in. And that's the case with quite a few people on the shielding list. Some of them we did not have complete details for, but we have looked at other ways of seeking that information from them. So just now I'll just move that across. And then there is a consent tab at the bottom. And again, within the questionnaire, there is also a consent question moving forward. So the next part of it is in terms of the shielding details. And again, some of this would already come pre-populated so that we can put in a doctor's practice. There is an anonymous doctor's practice just now that should call up, hopefully. Yep, and I can use that. Oops. We can then select the gender for the person moving forward, male or female, obviously, and a birth date for them as well. So again, the RAG status that's used for us is to decide whether or not that person is a high priority for us, and those on the shielding list were always categorised as red because they were the ones that we had to deal with immediately. There is a field for notification of death, and what we do on that event is actually we deactivate the contact itself if we know that that person has died, and we get that information direct from NHS. We have the ability to add in a UPRN and an X and Y coordinate, and we can then also add in the housing area and the locality. I won't do that just now, and that will eventually then create a Helping Hands ID for us. Some of the other questions on this part of the sheet are completed by the questionnaire, so I will not go into those just now. So I will then save this as a new contact. Okay. What I should then be able to do is to click on the questionnaire button, and that then will allow me to create a new questionnaire linked to that contact. And this is the questionnaire, and you'll see it has already pulled through some of the information from the contact. So it's pulled through the name, the CAI number, and the doctor's practice, and that then allows me to then fill in the rest of that questionnaire. So the first one is about interpretation. Does someone need an interpreter, or are they a veteran? And these were linked to specific service deliveries within Helping Hands. We then go down and ask if the person who's completing the questionnaire is themselves or someone else. In this case, what I'll do is tick for myself, but if I don't, then that will ask for the details of the other person, and it will ask for their relationship with that person requiring support. And that then means that another contact will be created that will be linked to that person if we know that that's how we need to obtain their information moving forward. It asks for the number of adults in the household. I'll say 2 just now, and no children. It then asks me if I want to put in additional comments. So for instance, in that box, I can then add the age of the children. I can then add information about housing association or council tenant if that's necessary. And then it asks a specific question if someone has someone who already supports them in relation to their needs. So again, if I say yes in this, it will then ask me, what do those individuals help you with? So maybe it's about getting money from from the bank or whatever. There's a default question that asks about internet access, and that was linked to a piece of work that the Scottish Government had underway around the availability of internet access for people. The default for that is yes, and then we move it otherwise. This is the part in terms of shielding. So have they received a shielding letter, a yes or no, or have they been asked to stay at home in terms of medical advice? And again, it will then ask them what was the reason for that. Was it a heart condition? Was it something else? And that allows us to put in additional information about that person. And then we also ask if that person knows how to contact NHS 24 in terms of obtaining additional services. And again, at the moment, I'll just mark that one as yes. We now move on to food and prescriptions area, and this is about specific help to these individuals moving forward. The first one was more about their personal details. So they're asked initially in terms of NES and the NES referral, so that is the National Food Delivery. Have they used the service that was available there, which was a food text opt-in? And we can select yes or no. In this case, I'll select no. Do you want us to sign up in their behalf? A yes or no. And the other issue then becomes how many boxes do they require? So there was the equivalent of a box per person. So if it was a 2-person household, that would be 2 boxes moving forward. And then there was a supplementary question about priority access to supermarket slots. So that would allow people to say, yes, they wanted to be put on a list for Asda or Tesco or somewhere else, which would allow them, we would inform the supermarkets of that, and they would then be added to a priority list so that if they then went in to look at shopping, they should then be able to book a slot with that particular supermarket, and we're asked for the name of the supermarket. So just now I'll just say it's Asda. We then go on to a food referral. So we're asking if they've got any dietary requirements. We're also then asking if they're waiting for an S box, do they actually have food prior to that? And if that is no, then they're asked, is your household having difficulties in obtaining food? And if that is the case, and if we say yes for this, we're asked then to categorise that. So is it because of lack of money, inability to get to the bank, unable to get to the shops, unable to use online delivery, and whatever that may well be. So I'll click on lack of money just now. We also then ask them about, do they need assistance to collect food from the supermarket? And that was linked through to our third sector partners who could then help with food delivery. So if it was a pick up for a collect order at the supermarket, then someone could help with that. If they wanted their food delivered to another address, if they were staying somewhere else, so if it wasn't their primary address, they could input that at that point as well. And then they're also asked if anyone else within their household could comfortably take in this, and that was taking their shopping, and that was a yes or no. We added in a supplementary question later on also about sanitary products, because obviously about that, the whole initiative from Scottish Government about free sanitary products. And individuals were asked about that as well. And then any other additional comments around food. And the last one is this urgent or not? And in this case, we'll say it is. So the next section is on prescription referral. And again, this was focused on individuals who wanted the prescriptions picked up and delivered to them. So again, if I select yes on this, what it then brings up is another set of questions. So when do I need it done? So that would be for me to pick a date. Do I have a pharmacy? Yes. And then I would put in the details of that. So if I put in Boots just now, it gives me a Boots branch that I'll pick. And then again, if they were living at an alternative address, then if that prescription had to be delivered there, we could input that there. And if there were any other additional comments about picking up that prescription, those would go in that box. The third page is then for other assistance. So the first one was around fuel referrals, and this was about needing assistance to top up for fuel meters or cards. And here again, people were asked to say yes or no. I'm going to do no in this. They were asked to then spend, and you'll notice if I say no, that removes those other questions. So the questionnaire is designed in such a way that supplementary questions are activated when you answer either yes or no to a particular trigger question, and thereafter those questions come in. So if I then go to this one and say, I do need financial support, then what you see is another set of questions appear, and I can then categorise that. Is it about lack of money? Is it about unemployment? Is it about both? Is it about debt? And then if there are any other details that I want to put in there, they can go in, and that will give our financial advice team who would receive this referral further information about the individual when they contacted them to be able to understand what the need was at that point in time. This section is about a wellbeing referral. And this is about, do you have any concerns about your well-being? And this was focused on isolation, but it was also designed in such a way that we were aware of the rise, for instance, in things like domestic abuse. So that's why this question is here. So in terms of well-being, it was linked to some of that discussion. And that's why the question about, are you free to discuss this now, is here. And that can be, say, yes or no. And if it's a yes, then you can put in what that is. Maybe feeling isolated. And again, that would allow us to refer that on that way. A social care referral was more to do with home support and caring responsibilities. So do you as a person, as that individual, have a caring responsibility? And again, here, if I say yes, what happens is it asks me about that. So if I say caring for partner, then that just allows for more information. We then ask the question about, are you currently receiving a home support service from the council? And again, we can tick yes or no or unknown for that. In terms of social contact, again, this links back to, do you want us to keep in touch with you? So would you like us to phone you back after 7 days? This can be a yes or no. And again, maybe in here I would put, as I did previously, about feeling isolated. If I could spell, that would be fine. Okay, and then the other one are a mix of other things which could be made specific for an individual local authority area. So we did offer a dog walking service through our third sector. So again, if someone required that service, I could tick that, and that would be a referral to a third sector organisation to help with that. We also had food vouchers for our children in school. So again, possibly because of self-isolation or at the start just because of lockdown, individuals might need help and support in collecting a food voucher. So again, that would be a yes or a no. And then a general catch-all question, which would be anything else we can help you with. So whatever that may well be moving forward. And that's that page complete. And we then go on to the final page. And what you'll see here is, as a result of what we have answered in the questionnaire, this has then allowed us to create a set of referrals which will become active cases on the system. So that by the way I've answered that question, I'm asking for a financial support referral to our FIT team. I, in this instance, want to get a food nest box from Scottish Government, so a breaks delivery of food. But I've also recognised that there's a requirement for urgent food, so therefore, again, our financial team and with our partners in food cooperatives, etc., would know that they had to create a specialist delivery for that individual as urgent food because they had nothing left, they had no food left. Then created another referral in terms of financial inclusion team and a prescription referral and a social care referral because I've indicated that we need that, and a social contact referral, so that's about isolation, and a wellbeing referral, which is also about isolation. And the final part on the page is a link to the individual who is handling the call would have to seek consent from the person who has dialed in to understand that this information that they have given me as part of this process will require to be shared with others inside the organisation and possibly even with some of our third sector partners who are delivering those services. And therefore we needed to seek active consent from them to make sure that they were happy about us sharing their details. So again, that would be a consent box there, and then that questionnaire would be submitted. And saved.
So from a user experience point of view, there's a few things that I would like to highlight, both as part of the Helping Hands development and then how we went on to use it within North Lanarkshire Council. The first and most important part for us was ease of use. So by the time the system came into being, our call handlers had already created a number of questionnaires. There was about a backlog of 6,500 records by the time Helping Hands became live within North Lanarkshire. And from early on, it was really important for us that the questionnaire that had already been created and we talked about earlier on was reflected in the build. This allowed us to cut down on the level of training that was required for our operatives, because at one point we had over 200 operatives in the system dealing with the inbound and outbound calls. The system that we developed from version 1, which was the front office, which again was about creating that backdrop of being able to take those inbound and outbound calls, was then sort of developed into version 2, which allowed us to become much more intuitive in the way that we were handling those calls, but also in the way that we were pushing out the information to our third-party organisations that I mentioned earlier on. So we had a raft of organisations that were supporting the council, and we were clear that it had to be a seamless development from the calls coming in and also the services that we were going to deliver. And Gavin actually mentioned some of those earlier on, and I'll come back to those. The ability to handle large volumes of data. So I've already said that we had a backlog of 6,500 records, which took us over a week with teams working round the clock to get that information into the Helping Hands system, because it was important to us as a council that any of the previous requests were already captured in the system, and everybody was working in a kind of case study sort of scenario with the information that was getting put into the system. On the shielding list, we had 12,500 people in North Lanarkshire. And as I said earlier, North Lanarkshire is one of the largest councils in Scotland. It's the fourth largest. We have a population of 324,000 people. Over the early days of the number of calls that we took, as I say, it was important that we were set up to be able to assist in any manner that was required, not just the categories that had been developed by Scottish Government. And as we mentioned again earlier with Gavin, that the data privacy information was really important to us, because over the piece we've had 30 downloads of data from NHS Lanarkshire into the Helping Hands system. The system was developed for us, and it was, I'm not saying it was straightforward without challenges, but it was straightforward in the fact that we already had a relationship with Agilisys as our system integrator partner. As we mentioned, we've had Agilisys working with us over the last 14 months to develop various parts of our digital transformation programme, whether that stretches from waste right through to the business intelligence hub and our data management systems. But it was important that we were able to build on that existing relationship. And whilst the development team for Helping Hands wasn't our development team, we were very quickly able to recreate that relationship with Simon and the others that were involved in that. We worked with Agilisys as a development partner, not just for North Lanarkshire Council, but for all local authorities using Helping Hands in Scotland. We were the reference point for that development, and we were proud to take on that role. So again, working as that development partner meant that the interface that we had with Agilisys, again, made the system easy to transfer into our live platforms. We were the only council at that time that were developing Microsoft Dynamics as our own platform. And therefore, it was an opportunity for our staff to get early sight of what was coming on along down the line for us as an organisation, particularly in November time last year when we implemented the first of our new services within our own Dynamics platform. And as Gavin mentioned as well in the timeline, it was important for us to make a decision when we got out of the shielding in July last year. What were we going to do with the data and the system that we had worked hard to develop? And the decision was taken within the council that we would continue to use Helping Hands. We didn't want to pay twice for Microsoft licenses as the free 6-month period came to an end. So therefore, it made sense for us to work with Agilisys to bring that into our own platform. And one of the things from our point of view is that we are still using, as we mentioned, the Helping Hands system. We at this point in lockdown are receiving around 700 calls a week. Still for people looking for befriending services, which we found have become even more important in this second phase of lockdown. And I'm sure you've seen all of the social media and the media briefings on mental health and so on. And we provide that service through Helping Hands. And again, very proud to do so for our very diverse communities in North Lanarkshire. And really the whole sum and substance of us taking on board this system was to make sure that we could reach those most in need across all of our diverse communities. And from our partners' perspective on the delivery side, they were very grateful to be involved with us. It really did bring out the true sense of community and the work that we can do if we pull together. But also it meant that we were ensuring that no one person and their requirements would fall through any cracks. And again, Helping Hands and the dynamic solution that we have allows us to do just that. And really on the left-hand side of the slide there, you'll see that by the point in July, we had made over 12,000 calls to people on our shielding list. We had provided over 1,100 referrals to social work services, to our financial inclusion team, and to NHS other services. We had delivered over and above the NEST packages that Gavin talked about, almost 6,000 food packages through food banks, etc. And also we had delivered over 1,000 pharmacy prescriptions, and all of that was done through a network of volunteers and willing and able staff who were on a list of going out and providing that support. So we shouldn't lose sight that the whole point of North Lanarkshire being involved in Helping Hands was to provide services to our communities.
Thanks, Linda. I think that's a great example of the benefits of working together in a collaborative and rapid, agile manner, and what it can deliver in terms of crisis, as we found when we went through this process. Thanks very much for listening and watching. You can see our contact details on screen if you would like to reach out to us for any questions that are not covered as part of the follow-on to this call. Happy to take your questions either now or as part of that follow-on call conversations that we can take place. Thank you.
Thank you.